Pain management is a very specialized subspecialty of neuroanesthesia and neurospine surgeons. And the pain has always been the most important factor for the patient. They can compromise with other things, but pain is something which brings you to the hospital. And right diagnosis, the right approach towards pain management is very necessary. Otherwise, you end up taking medicines without reason, without much efficacy. And this is something that affects your quality of life. And approach has to be multimodality in pain. It cannot be a single frame that we do only this. That will not work. That's why a comprehensive team and a plan has to be there for every patient. Usually the management starts with finding the cause for the pain and treating the cause of the pain. If that is done, most of the time the pain will go away. If there's a spine problem which requires a surgery and you're just trying to manage the pain, that's a wrong approach because you have to treat the cause first. But then there are cases where there is no apparent cause or all treatments have been done but they have failed, like something called failed back syndrome, in which you do spine surgery over and over again but the symptoms don't just go away. For that, there has to be multimodality approach. It can be special nerve blocks, joint blocks, pain blocks. If they work, but they are temporary solutions, sometimes they work very well. If a candidate is suitable for that, that should be the approach. If that does not work, you can go towards thinking about non-invasive stimulation of the cord to get pain relief. You can do physiotherapy and stimulations to counter the pain. You feel or perceive the pain when it reaches the brain. The signal for the pain, we are talking about legs, if the source is back and the legs, then you will feel the pain when the signal reaches the brain. So the concept and the idea behind spinal cord stimulation for pain is disturbing the pain signal midway before it reaches the brain so that you don't perceive the pain. For that's very important that we are sure there's no treatable cause for the pain left and pain is the only symptom which is there and no other treatment is required. So in this case, we place a small wire through a small hole in the skin over the spinal cord surface, which is called epidural surface, and then we stimulate the spinal cord. So what it does is it disturbs the signal or the electric signal relaying from the legs to the brain, and patient does not perceive the pain. In this kind of treatment, we have a trial phase where you just place a wire for a few days and leave it with no source of battery inside, so that you can experience it's helping you or not. In what activities you're feeling good pain relief, or is it not helping you? Once we are sure it's going to help the patient, then we implant the pacemaker with a small surgery. Sometimes people who have diffuse pain and which is not amenable to, say, spinal cord stimulation, then we have like cancer patients where the quality of life is only hampered by pain. We do something called intrathecal drug implantation systems or pumps. It can be a baclofen pump if the person is spastic, like can be case in spastic cerebral palsy or brain injury or spine injury, or hereditary spastic paraparesis. Or it can be severe pain like in cancer patient or any other cause of pain which is not getting treated. So we use morphine pump in those cases. Why this is better option than using medicine? Because efficacy of these pump delivery systems is very high. The medicine is delivered by a small puff, like a perfume spray, into the spinal cord directly. So it does not enter your bloodstream. It doesn't go to your liver, kidney, or rest of the body. It doesn't harm you. It doesn't make you sleepy. You don't need to pop in 100 pills a day. The efficacy is higher. The safety profile is much more better. And it takes a small surgery. But the main thing is that the doctors treating should be sure this is the option required.